I'm Prateek Khanna. I'm one of the GU medical oncologists at Dana-Farber Cancer Institute, and I won the 2023 Translocation Focus Award by KCA. Translocation kidney cancer is a rare variant of kidney cancer that is characterized by certain gene fusions involving MIT-TFE gene family. And it involves about 5% of patients with kidney cancer in the adult population, whereas about 50% of the pediatric population with kidney cancer has translocation kidney cancer. My project focused on developing new therapies for translocation kidney cancer. So far, the existing treatments for this type of kidney cancer are validated in more common varieties, such as the clear cell kidney cancer, and as a result, the patient outcomes are worse compared to the more common varieties. So my focus for the research project was to develop a new treatment that specifically focuses on the biology of translocation kidney cancer. In this project, I propose to develop cell surface therapeutics such as a T-cell engager or a CAR-T treatment that leverages the patient's own immune system to attack and kill the cancer cells. Since I received the award, we have been able to mature the technology that we were developing in the lab. We identified a cell surface molecule, a protein that's uniquely expressed on the cancer cells in translocation kidney cancer and not on other varieties of kidney cancer. And this protein is also not present in majority of your normal tissue. So the idea is that if we can develop a therapy that involves immune cells that specifically kill off the cancer cells that express this protein, it might be able to specifically target the cancer and not the normal tissue. In this project, now we have identified the presence of this protein, a form of cadherin protein, on almost all translocation kidney cancer patients. And we have used structural engineering to develop antibodies expressed on CAR-T cells. We have subsequently run functional assays where we have in laboratory tested these T cells against the cancer cells, and we have seen that some very specific antibodies expressed in these CAR-Ts can kill off almost all the cancer cells. Then I identified some very potent candidates for these CAR-T cells and have validated them in animal models. So at the present moment, we have a lot of good data in both the animal models as well as in the petri dish that this technology can work and kill durably the translocation cancer cells. Our hope in the next 1 year or so is to now develop CAR-T cells with the idea of bringing it into a clinical trial in near future. Absolutely. I think so. We identified a new target that wasn't described in translocation kidney cancer before. And beyond that, we have developed their technology to identify and kill cancer cells that express this protein. And we are very close with the technology and with our resources to develop this into a clinical trial. Now, there are some regulatory processes that are involved, but we think that we can go through those within the next few months to up to a year. And this can actually be one of the first translocation kidney cancer biology-specific trials that we can offer to patients. And our hope is that patients will have much better responses with this treatment than the existing therapy and can actually benefit patients either in the adult population or in the pediatric population. Most of the clinical trials in rare kidney cancer space are generally some sort of combination of existing treatments that have been developed, validated in biology of clear cell kidney cancer. So even when we are very hopeful that these clinical trials may actually have better outcomes than the existing treatments, none of these existing trials are guided by knowing the biology of translocation kidney cancer. Developing a CAR T that targets a protein that's specifically expressed on translocation kidney cancer makes it one of the unique clinical trials where we are trying to see if a treatment developed specifically for translocation kidney cancer can improve patient outcomes. Yeah, state of translocation kidney cancer research. I think we are entering a very exciting time. We have multiple laboratories across the world that are specifically focusing on translocation kidney cancer, and we are trying to understand how to tackle this cancer through multiple treatment strategies. For example, I'm focused on developing a cell surface therapeutic, such as a CAR T treatment or even a T-cell engager, where I'm trying to leverage immune cells to go after the cancer cells. At the same time, we have more papers coming out of some of the laboratories, including that of my mentor, Srinivas Viswanathan, where we are also exploring the unique metabolic properties of translocation kidney cancer, or its exquisite dependency on certain proteins such as CDK9, CDK4, CDK6. So based on the new research that's coming out, we can potentially look at also evaluating some drug molecules in near future. I think it's very exciting time because I foresee that we will have different strategies that might develop into realistic treatments for translocation kidney cancer patients in near future. I think each patient deserves a treatment that's specific for their own cancer. I think we are entering a time where we have a lot of answers for more common cancers, and at the same time do not have any answer for patients with rare cancers. I think we have the resources, the community, the patient advocacy, and support from associations such as KCA, where we can utilize the entire ecosystem to develop treatments that are specific for rare kidney cancers. I would also highlight that developing treatments is not easy. It requires a lot of bench science, and then identifying some of the promising targets that need to be translated into clinical trials. And that requires a lot of different skill sets, that requires a lot of financial resources, that requires a lot of focus on what is the more important clinical question. And I think we are at a stage where we have enough community in kidney cancer that we can address all of these challenges and focus on developing treatments for each of the rare kidney cancer. Yeah, KCA's support has been fundamental for my early career trajectory. I was awarded the 2023 KCA Award in Translocation. I was also awarded the inaugural Dr. Nizar Tanir Rare Kidney Cancer Scholar Award in 2024. And it was the combination of both the financial support with the grant, as well as the access to excellent mentorship with all the institutions that have partnered with KCA, that I have been able to not only focus on developing treatments for translocation kidney cancer, but sort of also navigate the early career decisions, whether I should just focus on making a niche in rare kidney cancer. I'm also interested in early phase clinical trials, so a lot of mentorship that I have received from mentors through KCA has been very fundamental to developing my career in rare kidney cancers. Yeah, it's very important to collaborate with patient advocacy groups through KCA or Joey's Wing. We are dealing with rare cancers that a larger population might not be aware of. Developing treatments need um, research grants. It needs scientists to focus on these questions. It needs advocacy for support for development of these treatments through regulatory processes. It also needs collaboration amongst institutions to coordinate and have enough patients come on a clinical trial so that we can show that a new treatment is actually better than the existing options. And all of this would not be possible without partnering with patient advocates, because they play an important role in creating awareness amongst the scientific community, amongst the physician community, amongst the caretaker community, but also amongst the policymakers. And I think when I'm busy in the lab or in the clinic trying to develop these treatments, I think the patient advocates play a more important role in advocating for my efforts out in the population and amongst the policymakers. So I think it's really important that we are able to connect with the patient advocates, hear their stories, and figure out how we can help them. How can we help overcome their challenges with both the medical diagnosis, but also their challenges with the life dealing with these medical diagnoses.